Single-sided deafness, or SSD, can have a profound impact on a person's life, making it challenging to detect sound direction, communicate in noisy environments, and fully engage in social activities. While not all cases of SSD can be prevented, there are ways to reduce risks. Here's what you need to know about SSD, what causes it, how some cases can be preventable, and how working with one of our audiologists in Mesa or Scottsdale can help. Single-sided deafness is the significant or complete loss of hearing in one ear, while hearing in the other ear remains normal or close to normal. Unlike traditional hearing loss, which usually affects both ears to some degree, SSD affects only one ear. This leads to difficulties in localizing sounds and understanding speech in noisy environments. The effects can be isolating, often impacting a person's quality of life and relationships. SSD can result from various factors, which can be categorized into congenital, or present at birth, and acquired, developed later in life, causes. Congenital causes include genetic factors. Certain hereditary conditions can cause hearing loss in one ear. Birth complications. Complications during birth, such as low birth weight or premature birth, can lead to SSD. Maternal infections. Illnesses like rubella or cytomegalovirus during pregnancy can also increase the risk of hearing issues in newborns. Acquired causes include infections. Viral and bacterial infections like mumps, measles, and meningitis can cause damage to the auditory nerve or inner ear, leading to SSD. Head trauma. Injuries to the head, especially near the ear or auditory nerve, can result in hearing loss in one ear. Loud noise exposure. One of the leading causes of hearing loss, including SSD, is sudden or repeated exposure to loud noise. Acoustic neuroma. This benign tumor develops on the auditory nerve and can cause SSD if left untreated, or if treated with surgery that impacts hearing. Sudden sensory neural hearing loss. Sometimes individuals experience a sudden, unexplained loss of hearing in one ear, possibly due to viral infections or vascular issues. While SSD isn't always preventable, there are steps you can take to reduce the likelihood of acquiring it. Number 1, protect your ears from loud noises. Exposure to loud sounds is one of the most common causes of hearing damage. To protect your hearing, wear ear protection in loud environments and avoid prolonged exposure to high noise levels. Noise-canceling headphones and custom earplugs can be especially helpful. Number 2, practice safe listening habits. Limit the volume when using headphones or earbuds, and follow the 60-60 rule. Listen at no more than 60% volume for no longer than 60 minutes at a time. This can help reduce the risk of damage to your auditory nerve. Number 3, seek prompt treatment for infections. Viral and bacterial infections like mumps and meningitis can lead to hearing loss. Preventive measures such as vaccinations and immediate treatment of infections can help protect your hearing health. Number 4, wear protective gear for sports and physical activities. Accidents and head injuries can damage the inner ear, leading to hearing loss. Use helmets and protective gear in sports or activities where you may be at risk of head trauma. Number 5, schedule routine hearing checks with your audiologist. Regular hearing assessments are key to detecting early signs of hearing loss. Catching issues early can help you address hearing health concerns before they worsen or lead to SSD. If you or a loved one is experiencing hearing loss, it's essential to consult with a professional. Our audiologists in Mesa and Scottsdale specialize in diagnosing and managing hearing loss, including single-sided deafness. Here's how we can assist. Comprehensive hearing assessments. We perform thorough evaluations to determine the cause and extent of hearing loss, including SSD. Custom hearing loss prevention strategies. Based on your lifestyle and hearing health, we can recommend personalized strategies to treat existing hearing loss or help prevent further hearing damage. Ongoing support and counseling. Adjusting to SSD can be challenging, but our team provides ongoing support and education to help you make informed decisions about your hearing health. If you're ready to prioritize your hearing or have questions about SSD, schedule an appointment with one of our audiologists in Mesa or Scottsdale today. Together, we'll help you achieve your best hearing health.